and usually it is detected as a opportunistic finding when usually people come for some other morbidity, some other problem to our clinics. So at clinician and
So are you able to hear us?
At least. And there are innumerable other things which we have to follow. Am I audible?
Yes, sir. You're very much audible.
So, it has different names like non-communicable disease, lifestyle disease, and it often leads to a lethal complications if left untreated, like coronary artery disease or cardiovascular arrest, chronic kidney disease, and other vascular complications. So it is better to follow the levels of prevention, that is primary and secondary level of prevention, to avoid the later complication. So it is a silent killer because there is no obvious symptoms and it remain undetected in most of the people. So the normal systolic blood pressure is less than 120 millimeter of Hg, and diastolic should be less than 80 millimeter of Hg, and higher the blood pressure, higher will be the chances of cardiovascular disease, stroke, and renal disease. As Sir George Pickering first formulated a concept that BP in a population is distributed continuously. So it remains homogeneously distributed across the population. And we'll discuss about the various strategies to cover population-based screening or high-risk screening. So as this slide is visible, and that normal blood pressure is less than 120 by 80, and we can categorize into various stages like pre-hypertension, which is 120 to 139, and diastolic pressure of 80 to 89. So either of these is important. So person can have a unilateral or only systolic raised and diastolic normal, or vice versa. So hypertension stage 1 is 140 to 159 by 90 to 99. Hypertension stage 2 is more than or equal to 160, and diastolic of more than or equal to 100. So this is the categorization of blood pressure. In other words, we can have a essential hypertension and secondary hypertension. So most of the hypertension we come across is that is 95% is essential hypertension. There is no single underlying cause, we can say, and secondary hypertension due to certain disease or some condition. So if we look into the incidence of disease in India, 25% of urban population and 10% of the rural population. So it is more common in urban area. It is more common among males as compared to the female, but after 60s, it increases in female as well. And in pediatric age group, it remains equal in both the genders. So 70% of all hypertensive patients are in stage 1 hypertension, and 12% of hypertensive suffer from isolated systolic hypertension. That is either systolic is raised or diastolic is raised. In this figure, we can see that there is a transition of diseases, that is what we were observing in 1990s, where the non-communicable disease was 53.6%, and non-communicable diseases were around 38%. Now it has increased. Non-communicable disease has increased significantly, mostly because of the lifestyle factors. Because other non-modifiable factors were still there, like age or genetic factors or family disease or familial causes. So those were there, but due to change in lifestyle, and that we will discuss more in detail. So here also you can see that the high blood pressure kills nearly as many people worldwide each year as all infectious disease combined. So high blood pressure remain constant with many other factors. So if high blood pressure and diabetes is there, or high blood pressure or any other infection is there, then it increases the severity of the disease. Like obesity, you can club, cancer, you can club, and many other risk factors. If get combined, then it causes more harm. So other predisposing factors or risk factors are like advancing age. So it is not the advancing age, but factors actually keep accumulating. Like in adolescence or in a childhood age, we usually do not follow the physical activity, and which is more now practiced. Like all kids are involved in less physical activity, but more with their computers or mobiles and tabs. So these factors get accumulated over the years, and obesogenic environment is there, and stress, and all these factors. So with advancing age, actually, it manifests more, but per se age alone is not the only cause. Then men and post-menopausal women shows higher chances, or it increases the risk. Then family history is definitely, it run in families. So those who have a family history should take precautions, and there lies a role of primary and secondary prevention. Primary prevention is when factors or risk factors are there, but one has not developed the disease. So in primordial or primary level, if one takes the precaution, then one can avoid the complications of later life. Then sedentary lifestyle, psychosocial stress, smoking, high cholesterol diet, low fruit consumption. All these are the modifiable factors, like sedentary lifestyle, smoking, high cholesterol diet, low fruit consumption, obesity, and weight gain. So all these can be controlled. Coexisting disorders such as diabetes and hyperlipidemia, high intake of alcohol. So we'll discuss some are modifiable factors and some are non-modifiable factors. So modifiable, like obesity, salt intake, we can always limit our salt intake to less than 5 grams. But if person has developed hypertension, then it is advisable to limit it to less than 3 grams. So it is only if we start taking less of sodium and comparatively more of potassium, then it is always better. And once we will develop this habit, then it will be, means people will be comfortable in that situation also. So more of the dietary fiber is required, less of alcohol, and syndrome X or metabolic syndrome, like many metabolic diseases increases the chances, like diabetes. More heart rate is definitely not required. More of physical activity is required. Environmental stress is not required at all. Socioeconomic status and other factors. So all these are modifiable factors, while non-modifiable factor like age, gender, genetic factor, ethnicity, and fetal factor. So these are non-modifiable factor. So it is advisable to follow the life course approach for this, and right from the antenatal cases, like in during pregnancy only, one should, if start following the healthy lifestyle, then we can avoid the later complications. So here you can see that if the blood pressure of systolic by diastolic is 115/75, then there are minimal chances of developing cardiovascular disease. With 135/85, it increases to 2 times, 155/95, 4 times, 175/205, 8 times greater risk. So with the high blood pressure, cardiovascular disease development is more. So there are some rules which I was discussing, that the rule of halves. So around 50% of the population is not aware of this blood pressure, and they have never measured their blood pressure. So 50% of the population remain unaware. And out of those population who are aware, only 50% take the medicines. And out of those who are taking medicine, only 50% take the right medicine and have their blood pressure under control limit. So this is how we can see that this rule of half is means we have to change this rule actually by raising the awareness, so that every person should be aware of this raised blood pressure and should take the medication and other lifestyle measures. So this is a depiction of the rule of halves. And again, this most hypertension in India is not controlled. So you can see that high.
So can you hear us? I guess there is some technical snag. We will just wait for Dr. Karkar to rejoin.
Am I audible?
Yes, sir. You're audible.
So the clinical manifestation, like there's no specific complaints or manifestations. That's why it is called the iceberg disease. And only small percentage of people actually were aware of their blood pressure, and large hidden part remains or silent part of the iceberg remain hidden. So some symptoms, people feel uneasy, or they may feel occipital headache, that is the headache in the hind part of our skull or brain, and dizziness, fatigue, and in severe hypertension, person may develop epistaxis or blurred vision. So that's why it is called the clinic silent killer.
So can you please pull up the slides? I guess it's not sharing.
Okay. Just a minute. Is it visible now? Hello?
Yes, sir, it's visible. Yes, sir, it's visible.
So these are the some of the complications, like in brain, one can develop stroke or dementia. In arteries, one can have arterial damage and narrowing, or aneurysm, that is the ballooning of the artery, or leg amputation is required in certain cases. And in heart, one can develop a coronary artery disease, heart attack, or congestive heart failure. And kidney failure or kidney artery aneurysm. So these are the complications, that is where tertiary level of prevention can be applied, but it is always better to follow the primary level of prevention, where we can minimize the economic loss as well as the morbidities and mortality. So this we have already discussed about the major risk factors, and some target organs like heart disease in the form of left ventricular hypertrophy, angina or MI, heart failure or stroke, chronic kidney disease, peripheral arterial disease, or retinopathy. So these are the target organ damage. And if this blood pressure remain undiagnosed. So these are the other complications due to hypertension, that is aortic aneurysm, blindness, chronic kidney disease, stroke, preeclampsia, cerebral hemorrhage. So you can see that there are a lot of complications can be done there if it is not controlled at the right time. This also actually we have discussed. Now coming to actually the barriers. So what are the social determinants of health that can affect early diagnosis? So one of the important thing is socioeconomic status, and other things are actually linked to it. Like you can link the socioeconomic status with the education level, and certain beliefs or attitudes can also be linked to it. So lower socioeconomic background may face financial barrier to seeking medical care, which can delay the diagnosis. Actually, national program supports the treatment part also, and many of the state government and national program supports the diagnostic as well as treatment part. But if person is not aware of these benefits, then or sometimes it remain hidden because it is a silent killer. So people are not aware they have to go and seek the treatment. So socioeconomic status, education level, lower level of education limits the health literacy to fully understand the importance of early diagnosis and timely treatment. Then certain health beliefs and attitude. So cultural beliefs and attitude towards the health and illness can impact the willingness of individual to seek medical care. Then other thing is access to healthcare. Access to healthcare because of socioeconomic reason or due to the low level of awareness, or maybe due to the limited facilities available in their nearby area. So health seeking behavior varies with the access to the healthcare, and sometimes some discrimination and stigma might be there. So if we want to address all these issues and we want to remove the social factors, then we have to work in improving the access to healthcare and increasing health literacy, education, and addressing the stigma and discrimination, and promoting the healthy environment, so that patient and doctor relationship improves further, and patient they should not follow the rule of half. And every patient or every citizen, every person should come forward to seek the treatment. Then what are the patient beliefs? and attitude in progression of hypertension, its complication like denial. So most people think that they feel good and they will not develop this hypertension. So denial about hypertension or downplay its severity, which affect the adherence to medication. Or even if they start taking medication, then if they feel better, they stop taking treatment and they are feeling better and there's no need of this drug, any drug. Or fear of medication is also there, like due to some certain side effects, they stop taking medicine. Then complacency, like about the hypertension management, especially if they have been living with a condition for a long time and have not experienced any significant complication. So if they do not have any severe complication, then also people remain complacent कि कुछ नहीं होगा, डॉक्टर तो ऐसे ही दवाई लिख देते हैं. So they do not take the symptoms seriously. Lack of self-efficacy. The patient may feel that they have little control over the hypertension and complication, and they are reluctant to follow the lifestyle factors which are important. Certain misconception about hypertension, such as that it affects only the older individual, or some families only follow these things. So, and it cannot be managed effectively. Then stress and anxiety are other factors at patient level. So these are the barriers to the hypertension diagnosis, that is a lack of awareness, limited access to healthcare, stigma, cost factor, side effect of medication. Certain factors like language and cultural barriers are also there, and lack of adherence to the treatment. So we have already discussed these factors, and some misinformation like addressing these barriers will require a comprehensive approach, including education, awareness, increasing the economic capabilities of a person, increased access to healthcare, addressing stigma, cultural barriers. So these are multifactorial actually, and not single factors cannot be blamed, though lack of awareness and socioeconomic reasons are the major partners. So barriers to the diagnosis from patient and physician perspective, like lack of symptoms. We have already discussed limited access to healthcare, cost, lack of awareness. So these are the factors from the patient's point of view. While if we'll discuss about physician perspective, then some of the physicians are also not aware of the right way to diagnose or address the complications. Sometimes physicians are busy in their OPDs and they do not spare enough time for their patients. So limited time to conduct a thorough evaluation for hypertension, especially if patient is not aware and patient is not telling about the symptoms of hypertension, then usually these things remain left. Or lack of knowledge, not aware of latest guidelines for hypertension, limited access to diagnostic tool, or some communication barriers like language problem, or maybe hesitation to between the doctor and patient. So this intervention is required from patient side as well as from the physician side to address the barriers. So how we can improve the hypertension diagnosis rates? So if we can have a screening of all the patients coming to the OPD. So every opportunity should be used And developing a routine blood pressure screening program is very important so that we can diagnose it at early stage. Improving training of healthcare providers so that they diagnose every case of the patients, and expanding the availability of healthcare services, that is providing access to every patient. Using technology can also be followed. Some newer diagnostic tools are available. Patient education and awareness on hypertension treatment. Collaboration with a community organization so that some non-government organizations, some grassroots level workers, they come up with a diagnosis of disease at field level. So we have done an extensive project at field level where initially we developed a tool with some common morbidities in the geriatric age group, and by identifying and coding these factors into no risk, some risk, or high risk, we actually screen the whole population with the grassroots level workers, and then those with us some risk or high risk were called to the our centers, which were established at primary healthcare level, and only 10 to 15% actually needs tertiary care. Largely 85 to 90% of the patient can be managed at primary healthcare level. So it is not costly if we can address it at right stage. So, and the rest of the care can be addressed through various government schemes, or financial help can be extended to such patients who need tertiary care. So incentives to the healthcare providers who are doing a good job of detecting at primary healthcare level, improving communication and rapport between the patient and providers, improving transportation to healthcare facilities to improve the access to all the patient. So these are some of the laboratory tests which are required for the diagnosis, like electrocardiogram, urinalysis, blood glucose, serum potassium, creatinine, or the corresponding GFR and calcium, lipid profile, some optimal tests like urinary albumin excretion, and more extensive testing for identifiable causes is not generally indicated unless BP control is not achieved. So these are some basic and optional tests. If a person is having a multiple morbidity or multiple risk factors, then the chances of complications increases. So these are some options like lifestyle changes. So lifestyle changes have many other rewards also for other, like if we can control obesity, if we can control blood sugar, if we can control hypertension, then we can provide a multiple benefit to the patient. So lifestyle factors play a very important role, and it actually decreases the need of medications, and it also decreases the later complications. So combination of medication and lifestyle factor is very much required, and many of the patient can, if follow the strict lifestyle factors as suggested by the physician, then many of the patient can be reverted back to follow the normal life. The management of underlying health conditions like high cholesterol, diabetes, or CKD, then regular monitoring is required. If a patient is on antihypertensive treatment, then periodical checkup is required so that whether the drugs are effective or not, or whether dose modulation is required. So the treatment goal is to provide a goal of therapy, lifestyle modification, pharmacological treatment, and this lifestyle modification is non-pharmacological treatment. Clinicians usually follow the algorithm for treatment, like which drug to start with and which drug to follow. So this diagram which shows actually, though hypertension is reflected in the later life, but it actually starts in the fetal life only. So many factors are present even during the pregnancy, and if we'll follow the healthy lifestyle during the fetal life, then infancy and childhood, adolescence, then we can minimize the chances of later complications. So do not start following these restrictions, lifestyle modification after 40s, but develop a healthy lifestyle factors right from the childhood age. So these are the steps which one has to follow, like avoid harmful habits, smoking and alcohol, reduce salt and high fat diet, lose weight if obese, regular exercises are required. And DASH diet is a special type of diet. It's having low calories and high potassium, which is recommended in some resistant cases of hypertension. And it is also advisable to follow the recent guidelines which food authorities are advocating, like FOPL, that is food labeling, which is present in every food now. So if one is going to buy certain food from the malls, then we can follow and we can see the packet, that is how much calories it is having. And soon we are also doing one study with all other aims, like how effective is this food labeling, and if all the citizen, every person is aware of these meaning of labels which are present in every food, like how much fat is there, how much calorie is there in every food, and we are trying to influence the at policy level, that is, if it is in the admissible range, then it can be reflected in the form of green signal, like we follow in the traffic signal. And if it is having a slightly high, then yellow. And if it is at the alarming level, then it can be shown in the form of red. So even illiterate people can follow those signals or guidelines, which are required, though industries are opposing this proposal, but these are very well required. So these are the 6 big lifestyle factors, that is mental well-being, that is sound mental health, there's no stress, good physical activity, good environment, that is pollution-free environment. Pollution also plays an important role in hypertension and NCDs. Good sound sleep of around 6 to 8 hours is required for every person. Healthy nutrition or balanced diet is required, and avoiding the substance use like alcohol, smoking, and all other things. So lose weight if a person is overweight, increase physical activity, reduce salt intake, stop smoking, limit intake of food rich in fats and cholesterol, limit alcohol, and increase the consumption of fruits and vegetables. So by adopting these modification, one can decrease the systolic blood pressure in their range, like by weight reduction with 10 kg weight loss, 5 to 20 milligram of Hg can be reduced. By adopting DASH diet, 8 to 14 of Hg can be reduced. With the dietary modification of sodium, we can decrease it by 2 to 8 Hg by physical activity. So if we'll combine all these factors, then we can reduce our blood pressure to a significant level or to a normal level. So I think I should stop now, and we can discuss if any queries are there.
Sure, sir. Sure, sir. That was a very comprehensive presentation by you, sir. There are many interesting questions which have been given by the attendees over here. So one of the question is, a person is a type 1 diabetic patient who has uncontrolled sugar levels. He wants to know about the risk factor and the chances of having hypertension.
I think I've already covered, like if one is having a multiple factors, like especially diabetes and hypertension increases the risk of cardiovascular complications. So it is always better to keep both the conditions under control. Like increased blood sugar increases the chances for stroke, that is person may get paralyzed, or cardiovascular complication like cardiac arrest is also possible. So it is better to control our blood pressure and keep your sugar under control. And not only pharmacological treatment, non-pharmacological factors, lifestyle factors play a very important role. By following a healthy lifestyle, one can always reduce these things. Like we have seen in Punjab, many parks are there in vicinity of colonies. So if we follow a simple exercise like 20 to 30 minutes of normal walk or some small exercises, then that can also help in reducing the weight, and it also reduces the stress level. Or yoga is also recommended.
Right, sir. So there is one question. Does summer heat, air / loo affect on BP? Someone has got nostril bleeding once due to, is it because of BP? Like during summers, if someone is going through like high heat air or something like that.
No, it is not directly related to this because and it usually happens during the epistaxis is due to high heat, but not due to the pressure. Means it develops even in normotensive patients. So it is not directly related.
Right. Sir, one question has been asked by Mrs. Shikha Swaroop. She says that she has a BP of 160/90. Does it lead to nosebleed, or is it just because of normal BP, which is the problem or the root cause for nosebleed?
Definitely, it will increase the chances of nosebleed, but during winters or epistaxis means there are various other causes, like the commonest is nose picking. So it is not the only thing. If there is a high blood pressure, then definitely it will increase the chances of bleeding, but it is not the alone factor. So definitely lifestyle modification or control of BP is required.
Right. So there is one interesting question. Why there is a difference between the right and the left arm BP?
It is due to the physiological factors. Means because our heart is located in the left part, and due to the physiological distribution of arteries and veins, these are due to the physiological factors.
One more question is asked by this gentleman again. Which is the best equipment for measuring BP? Is it the digital one or the traditional one?
Traditional one. The automatic blood pressure equipment is easy to handle by any person, but sometimes it is not accurate, and actually calibration is required for this, and automatic blood pressure which automatically get inflated, though if person is not measuring, then definitely it is better to follow automatic also. But earlier we used to use the mercury one, but now it is not recommended due to, as mercury is a chemical hazard, it causes a chemical. So other type of dial thermometer or other form of equipments are available. So that is recommended.
Sir, there is one question from a healthcare practitioner. What advice do you have for healthcare providers who are struggling to manage hypertension in their patients, particularly those who have multiple chronic conditions or other complicating factors or comorbidity?
Like I will give you one example. Like we started a geriatric friendly clinic. We used to find out many factors. Patient should feel comfortable in our clinical setup. So geriatric friendly clinic we started, and we used to recommend please use less of salt, please use or follow all the medications. Then we did qualitative studies, that is in-depth interview of many of the patient, and focal group discussions we conducted in the field level. And there we came to know that though we are advising to follow less salt or less of junk food or less of or more of balanced diet, but when we conducted interviews at the field level, then we came to know that at family level, sometimes these geriatric people have expressed that at least we are fortunate enough that we are getting some food, and at family level, some conflicts are there between, maybe social factors are there. So, बोले खाना मिल रहा है बड़ी बात है. Salt restriction, like we used to tell them कि अगर आपको कम salt चाहिए तो बाकी लोगों को नहीं effect होना. So this food can be removed, and for these elderly patients or who are hypertensive, then salt can be added for others. But sometimes it is not possible at their end. But if we'll do counseling at their home or their family caregivers also, then it is comparatively easy. अगर कुछ ऐसे resistant cases मिल रहे हैं, if we can rule out that secondary hypertension is not there, then we can give the counseling to the caregivers, their family members, or to the individual also, that you have to follow these. Otherwise, if we will make them aware of the complications, then people can follow. Or one, we have developed one app also at that time. So those patients who are hypertensive, we used to send them that health message, and we have categorized all the patient into 3 categories. That is green zone patient, which are not having any disease or which have controlled morbidity. Yellow means those which can be addressed at the primary healthcare level, and red which require a tertiary care approach. So large number of patients can be managed at like the categorization I have shown you, the hypertension, green zone was normotensive patients. I think you remember my slide.
Yes, sir.
So that slide was that IC material was placed in our OPD कि आपको इस जोन में आपको अपना वेट रखना है, इस ग्रीन जोन में आपको अपना ब्लड प्रेशर रखना है. सो यू हैव टू फॉलो दीज एडवाइस टू कम टू दिस स्टेज. अगर आप रेड जोन में है, सो यू आर इंक्रीजिंग योर चांसेस ऑफ कॉम्प्लिकेशंस. इफ विल कम टू ऑरेंज जोन और येलो जोन, और बेटर टू कम टू ग्रीन जोन. तो पेशेंट के पास एक टारगेट आ जाता था कि नाउ they every time they used to come and कि मेरा BP करो अभी कहाँ पे आया है. So they are also following our advices.
So there is one more question. A gentleman who is 55 years old, he's taking his medicines. Even he's well controlled on his diet. The salt intake is very low. Even then, the BP ranges from 125 to 145 and 80 to 95. Why is it high, and what precautions can be taken for this? And even if he stops taking sodium salt, what will be the effect on BP? I think.
Hello.
Yes, sir.
Am I audible?
Yes, sir. Yes, sir. You're audible. Very much audible.
So salt alone is not the only factor, but other like family history is important. Then lifestyle factors like sedentary lifestyle, if it is there, or person is taking treatment, adherence is there or not. So there are multiple factors. So those factors should be ruled out. Obesity, BMI kitna hai? BMI should be in the normal range. Means height by weight jo hai.
Right.
So the simple thing to follow is like if we can convert the height in centimeters, like अगर कोई 5 फीट का है तो 150 सेंटीमीटर हो गया. अगर आप उससे 100 माइनस कर दें तो around 50 is the ideal weight for that height. So these are the general rule, not exact, but one can easily follow these rules.
Right, sir. Well, there are many questions, but I won't keep you for long over here, sir. And lastly, Dr. Ratna, would you like to say something?
Yeah, thank you. I had one question. In our visits to the field, we found that many patients take medicines when they feel sick and stop when they start feeling well. So as a physician, what would be your advice to them in terms of increasing their risk to conditions like a heart attack or stroke when they start and stop medicines?
Madam, if we can show them certain case scenarios, or like the slide, if we can show some IC material displayed in our OPD, ki if you will not follow, then you can land up into these things. So it is always better if you follow our advice, and this is the most economical reason, and it also increases the chances for other family members. As everyone will be sufferer. So if they can follow our advice, then economically and for the family, it will be good.
Thank you, sir. The other scenario that we've seen in the field is that either patients have one visit to the doctor and then go on taking that medicine without ever visiting the doctor again. And the second scenario is that patients keep visiting different doctors and keep changing their medicines. So in both these cases, what is the advice to the patients? And does it have any risk if you either not visit your doctor and keep taking a medicine for years after years, or if you frequently change your medicines because you feel that your hypertension is not under control, what kind of risk is there to the patient?
If means blood pressure is high, then definitely it increases the chances of many complications. So for tackling such type of things, that's why we developed a app, or we have given a tab to our field workers who used to visit to these centers. And once we have registered these patients, then if person is not visiting us, like like I've told that we have categorized patient into 3 categories. So every green zone type of person has to visit it 6 monthly. Yellow type of patient has to visit say 3 monthly. So, and red category, they have to visit frequently. So if you notice that the person is not coming to OPD for seeking treatment, then this health worker can visit them. Though now under IHCI, Integrated Hypertensive Control Initiative, many such initiatives are being followed. But this initiative we developed and we categorized the patient. So this is how we can keep the track in our area. So these grassroots level workers can very well help in managing these patients. Or other social media can be used for raising the awareness. Once the people are not reluctant to follow these advices, then definitely they will come forward and take the treatment.
Thank you. As per the national program, screening is done for people over 35. But we now see many young adults, especially in their late 20s, also coming with hypertension. So do you think there should be a change in screening protocol?
Definitely, definitely. That's what I'm saying. These factors keep accumulating over the years. And if one is having a family history of such hypertension or cardiovascular risk, then sedentary lifestyle, lot of junk food, and now people have easy access to sweeteners or high calorie foods. So these all factors are increasing the chances of developing it at lower age. And especially for Indians, even at a lower BMI, we are more vulnerable. So it is required and some of the countries, they have implemented a policy at policy level, that is all these junk food should be kept, low salt should be kept in these junk food, like all these McDonald's and burgers, pizzas, pasta. They have high salt content, and trans fats are also high. So at policy decision level, if these can be implemented, like they are following all these rules, but in our country, these rules are not followed. So high salt content is there in these junk foods. So if we want to implement it at that larger level, then it is required. So population measure is one thing and high risk strategy is another thing. So those who are obese or following sedentary lifestyle are high risk patients. So more counseling is required for such type of patients.
Thank you, sir. One of our observations during a field visit has been that though patients take medicines regularly, they are not letting go of their risk factors, and that is because of the easy access to tobacco and alcohol, especially in the neighboring state. So where the licenses for alcohol have almost doubled or tripled over the last 2-3 years. As physicians and as patient groups, since health lies outside of health as well, in terms of the alcohol policy as well as the tobacco policy, how can physicians as well as patient groups like us influence other departments and ministries so that the supply for ingredients that increase risk factors becomes less?
Actually, we are doing some research also, that is second-hand smoke or third-hand smoke is also very bad. So like in airports, dedicated in some hotels, in hospitals, some smoke zones are created. But these smoke zones also have increased the risk of other who are visiting those areas. So actually, with COVID also, we have done a study, that is smoking with COVID, that is how much it increases the chances. Not only direct smoke, but second-hand smoke also increases the chances. So policy decision is definitely required, and intersectoral coordination. Only health ministry cannot solve the problem alone, but involvement of multiple sectors or other ministries is also required, so that they can create a healthy environment in foreign industries or factories. Some regulations can be followed at those level also. And ICDS or health ministry or food industry, like FOPL I was discussing. So food package labeling is also required. So food industry, if follow these norms, then patient can be made aware of these things. So intersectoral coordination is definitely required to control these conditions.
Thank you, sir. Thank you. And Rajat, back to you.
Well, thank you so much for your time, sir. On behalf of the organizing committee and participants, I would like to extend our heartfelt gratitude for your valuable contribution as an expert speaker to our webinar. We are truly grateful for you, for your time, effort, and commitment for advancing the medical knowledge. Thank you for being a beacon of inspiration and sharing your expertise with us, sir.
Thanks to you
Thank you so
also
much, sir.
for organizing such a session.
Thank you. Thank you, sir.
Thank you so much, sir.